Hello, my name is Janelle Wessels, and I'm going to be doing the inserting and discontinuing peripheral IV. Okay, so just to show what I have the IV extension tubing. I have an IV starter kit that I'm going to open everything right now just to make it a little bit easier for the purpose of the video. Okay, in the IV starter kit, I have my iodine, I have my dressing, my tape, and my tourniquet. I actually have a tourniquet right here that I'll be using. And then, let's see. Excuse me. Okay, also, I'll get into that later. So I have my sodium chloride solution, and then I have my 22 gauge needle, okay? And then of course my clean gloves. So 2 pairs of clean gloves, but for the purpose of the video, I have only 1. Okay, so first things first, we're going to want to verify the doctor's orders, make sure that they're the correct orders. So verifying the orders are correct, everything looks good. Okay, so we'll go ahead and go to the patient's room. Knock, knock, knock. Hi, Miss Smith. My name is Janelle. I will be your nurse for today, and I'm going to be inserting an IV. Can I go ahead and have your name and date of birth? Perfect. Okay, so I'm going to go ahead and gel in. Imagine there's a chuck pad underneath the arm. So I'm going to go with the left arm, and you want to perform your hand hygiene. I'm going to put my gloves on. Like I said, we're going with the left arm. So first things first is I'm going to prime my tubing. So I have my tubing right here. I'm going to take it out and make sure that the clamp is open. I'm going to take my sodium chloride solution, and I am going to prime it. So you don't want to just take that off. You don't want to touch really the tips. So we're going to go ahead and open this, get all the air bubbles out. Okay, and connect this to this. And just a little bit, the clamp is open, just a little bit so that we can prime it. Okay, primed it. I'll set that aside right there. Okay, and now we are going to look at the site. We're gonna do 4 inches. We'll probably try to get 4 inches, 4 to 6 inches from where we're gonna insert the IV. Get our tourniquet. We'll put it under here. We're gonna tie. We're also asking Miss Smith if she has been allergic to any iodine, because we will be using iodine to clean the solution or to clean the site. She's not allergic. So we're gonna assess the site. Everything looks good. Get some vein. We're gonna take our iodine. I'm not gonna open it for the purpose of the video, but take the iodine. We're gonna clean from the inner to the outer and then dispose of that properly. Let that air dry. Okay, so it's air drying. We're gonna get our 22 gauge needle. We'll take the cap off like that. Make sure that the bevel is up. Okay, so bevel is up. We're going to insert just a tad until we get some flashback. So getting flashback, we're going to lower and advance forward. Okay, safety, it's the white, so we'll press the safety. Okay, looks good. Assessing the site, everything looks good. We're going to go ahead and just put some pressure. We're going to attach it. And we're going to aspirate first. The clamp is open. We're aspirating first. We got good. Looks good. Now we're going to go slowly in. And we're just putting all of it in. Okay, all of it is in. So now we're going to take this off, put that to the side, close the clamp. Oops, take the tourniquet off. Okay. And now we're going to put a dressing on. So we'll put this dressing on. This is gonna, okay, we're putting that dressing on, perfect. And then we're gonna tape the side. So imagine the tape is going onto the side. I'm not gonna do it because it's kind of hard to take off. And I'm running out of tape off the mannequin. But we can do this one for the purpose of the video. So we're gonna remove the paper. Oops. Okay, so we're removing the paper. It's getting stuck. Okay, so paper is removed. Imagine the paper is removed. So paper is removed and everything looks good. This is to the side. And all right, okay, Miss Smith, everything looks good. I'm taking off my gloves and properly, I'm gonna discard them, but for the purpose of the video, I'm not. So taking off my gloves, performing my hand hygiene, and then walking out. Okay, so now we're going to discontinue the IV. So I'm gonna, again, verify doctor's orders, making sure that it's okay to discontinue. It's okay to discontinue, so I'll go ahead and knock, knock, knock. Hi, Miss Smith, can you just verify your name and date of birth? Perfect. Again, my name is Janelle. I'll be your nurse for today. I'm gonna go ahead and discontinue your IV. So again, I am donning my, or performing my hand hygiene. Then I'm gonna don my gloves. So gloves are on, imaginally. I'm going to get my alcohol pad and my gauze. And what we're gonna do is we're gonna use the alcohol pad to take off the tape because it's a little bit easier. So that's done. And then the tape right here. So we'll go ahead and just take off the tape. Okay, perfect. So we're gonna take off the tape. Okay, and then you just wanna kind of hold it, there you go, just a little bit so you're not making any movements. So tape is gone. And then what I'm gonna do is I'm going to gently grab a gauze, put it on top, and we're going to take the needle out slowly, 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 slowly. Inspect the catheter. Make sure everything's intact. We're putting pressure on the site for 30 seconds. Everything is intact in the catheter. We're going to discard that properly. Putting wound, and you can tape it if there's blood after the 30 seconds. So there is no blood, but I'm just going to tape it just in case. So we're going to go ahead and tape it. So it is taped. The site looked good. And we are good to go. Everything is done. Thank you.